Okay, welcome back to another edition of the Naturopathic Minute. I'm Sean Saraki. Today with me I got one of my special and favorite clients of all time. Her name's Suzy. She comes in and sees me on a regular basis, and what I'm going to do with her today is I'm going to go through one of my office sessions that I use and utilize with her. We do this about once a week to once every 2 weeks, depending on her schedule and when she can come in and see me. But what I like doing and working on with her is her hormones. We're balancing her hormones. Suzy's 51 years old, and she is pre-postmenopausal. So what we do is we work on balancing hormones. We work on balancing her emotions, moods, things like that, based on her health. And probably one of her biggest health concerns at this point in her life is her hormonal health. I'm going to introduce you to her. Her name is Suzy. Hi, Suzy.
Hello.
Suzy, let me ask you a question. You've been coming and seeing me for quite a while, probably 2 years, maybe longer. Why do you come in and see me? What kind of benefits do you see yourself getting from coming in and seeing me?
Okay. Well, I like the approach of doing it holistically. And so this type of treatment can monitor and register different where my body is health-wise, if it be hormones, which we're working on right now, or it can be like my energy, my brain health, my hydration. I mean, pretty much we can address anything that's going on, even parasites. But right now we're doing hormones, and when I came in, I was having about 15 hot flashes a day and night. And after 2 weeks of doing the treatment, they're completely gone.
Excellent.
And they have not come back.
Excellent. Did you guys hear that? 15 hot flashes a day, and after about 2 weeks of coming in and seeing me for hormone balancing, Suzy is not experiencing any of that. And I commonly see this. I see a lot of women, and this is a typical session that I do on women the ages of 40 to 65 years old in some form or fashion are dealing with some type of hormonal imbalances. This type of session and therapies that I'm doing here can really work. Thank you, and we'll be back in a second, and I'll show you some more of the things that I'm going to be doing on Suzy. Okay, we're back. Suzy's now connected. I'm running a test on her really quick. This test usually takes about 3.5 to 5 minutes. She's sitting there in a nice comfortable chair, relaxed. She has bracelets on her ankles, her wrist, and some on her forehead. Okay, and then she's kind of hooked up to my little testing device here. This is the quantum scale box, which interfaces into my computer. Okay, so the energy is being run through this box. It's testing her body right now for all the different energies. And what I'm doing here is I'm able to identify areas in her body. Let's see if I can get this to zoom in here. You can't completely get the idea. This right here is her adrenals. They're at 90%, so that's a good reading. Anything between 80 and 100% here is a normal, healthy reading. Her brain's at 96%. Her immune system's at 96%. Her hydration levels are at 83%. And then her oxygen's at 85%. So as you can tell, she has some good scores here. It does show here that she has a spinal energy issue. Okay, so Suzy is a regular for chiropractic care too, so I know she is addressing that. This is her cellular vitality at 80%. And then one of her weakest component right now is going to be her pH levels at 6.4. We want that at 7.0 to 7.4. Okay, so that's where we're at right now. I'm kind of just running the test on her, and in a minute we'll start getting into some of the different therapies. Okay, now we're on a hormone panel, and what I'm looking at are adrenaline, which is in the normal range. Her growth hormone is in the normal range. Her testosterone levels are a little bit low, so that's one of the hormones that we're working on as far as energetically doing some therapy on. Her follicle-stimulating hormone is normal. Her luteinizing hormone is normal. This is her penile, pituitary, and hypothalamus hormones. Now, those ones are her ones that are a little bit out of balance the most. So the penile, pituitary, hypothalamus are brain hormones, okay, that this piece of equipment can scan and identify. Her oxytocin is another hormone, okay. Her dopamine is another hormone. Now, dopamine levels are also out of balance. Dopamine levels are going to affect your moods, your concentration, your focus. So she has a little bit of hormone out of balance here. Here's her serotonin levels. Serotonin levels are normal. We just did a therapy on her. It says it rectified at the 47%. So what I want to do is I want to do another therapy on that. We want to get it to 85% or higher. We just finished the therapy, and now we got it rectified to 101%. So that's a good therapy. And now we're going to move on, but I think I got cut off a minute ago. It shows hormonal imbalances, hypothalamus, adrenal insufficiencies are another hormone that it's showing out of balance. So for adrenal insufficiencies. Now we're going to go to the stress and cortisol hormones. So these ones are related to her adrenal glands. Once again, the big one is going to be, this kind of shows a lot of the same ones: adrenaline, growth hormone, testosterone. Cortisol levels is a new one that shows up in this profile. Her cortisol levels are normal here. And another one that shows up on this one that's different is her aldosterone, which is normal. Her corticotropin releasing hormone, which is normal. And her ACTH hormone, which is another adrenal hormone, is also normal on this profile. Okay, but we do a hormone balance here as well. So we're going to do some correction here just to kind of balance all hormones. And when we get done with this, Suzy will be done with her session for today. How you feeling, Suzy?
I feel great.
Yay!
Very relaxed.
Well, Suzy, thank you for taking time to be on my episode of the Naturopathic Minute.
You're welcome.